Good evening, everyone, and welcome to today's wonderful session. I wish you're all scaling up for the NEET PG preparation. Every day morning as you get up, go to the mock test, daily mock test, take the 100 questions, check what are the topics where you are going wrong and how you can improve in those topics. Then evening once more, we have a discussion on those 100 questions. Like this, every day 100 questions, in 40 days 4,000 questions. Once you solve these 4,000 questions, you're 200% sure how to face the tomorrow's examiner courageously, because almost 170 to 180 out of these 200 questions of the examiner are going to come from these 4,000 questions. I can guarantee you, right? So paper is out. Only your job is every day take a test on the Incus app and move forward. Good to see Ravi Kumar Chilumala and many more who are all online. Please invite your friends. So, doctor, let's make the great beginning. Good. So, take a pen and paper during the discussion. Whenever I say sure short topic, just make a note of that and try to go back after the session is over to discuss. To attend the video on the 2000 HD videos. There is a course called 2000 HD videos for the NEET PG preparation on the Incus app. Just you need to go back to that and do the revision on the Incus app. So, doctor, which cell produces the surfactant in the conducting part of the lungs? It is the Clara cells, is what you need to remember. Good to see Pramod Gurjar and many more who are all online. Very good. Now, the Clara cells in the epithelium of the respiratory bronchiole, you can see the vesicle in the cytoplasm. So this is how the typical Clara cells typically look like. Now, there are club cells. The club cells are also called the bronchiolar exocrine cells. And they are originally called as Clara cells. And where do you find them? The club cells are there in the ciliated simple epithelium, and they secrete the glycosaminoglycans to protect the bronchiole. Bronchiole lining is what I want to underscore to all of you. Then one of the important function of the club cell that you need to remember is it produces the secretory protein, uteroglobin, which is similar to the lung surfactant. So that is a quick story about the Clara cells. Now, which bursa communicates with the knee joint cavity, doctor? It is the suprapatellar bursa, which you need to remember. So here you are having the suprapatellar bursa. You can see nicely it is coming and merging into the knee joint. Abduction of the vocal cords. What is a important muscle? Posterior cricoarytenoid. So you can remember, you can see the posterior cricoarytenoid along the dorsal aspect, the posterior aspect, posterior cricoarytenoid. And just like in Titanic movie, you know, the hero will be spreading the hands. Similar to that, this fellow is like posteriorly standing, right? Posterior cricoarytenoid. And what is he doing? The posterior cricoarytenoid, typically, this is called abduction. So it is causing abduction, is what you need to remember. Thermal sensation is carried by lateral spinothalamic tract. Subarachnoid space extends up to the S2 vertebra. So everything, anything about CSF. Once more, sure short topic मैं अभी बोल रहा हूँ आपको, लिख लो आपके white pages notebook में. डॉक्टर मुरली भरद्वाज guaranteed topics है ये. अगर ये पढ़े तो सीट नहीं मिले तो मेरा नाम मुरली भरद्वाज नहीं, definitely आएगा. So out of the 4,000 MCQs in this 40 grand test, I can assure you, doctor, 85% of the question paper, sometimes ditto same question आएगा कल के नीट पीजी में. So that is the reason. Don't think preparation means I have to read this much, that much. Nothing. Last 40 days, every day take the grand test in the morning and participate in the discussion in the evening. And रोज हम तय करेंगे 10-15 टॉपिक शूट शॉट आने वाला, और एवरीडे 10 to 15 टॉपिक्स डिसाइड करेंगे, और 40 डेज में आपको 600 टॉपिक्स का डिसाइड हो जाएगा, और उस 600 टॉपिक से आपको मिलेगा 170 आउट ऑफ 200 क्वेश्चंस. दैट इज द सीक्रेट ऑफ विनिंग द नीट पीजी जस्ट बाय स्टडीइंग लास्ट 40 डेज विद डॉक्टर मुरली भरद्वाज. So subarachnoid space extends up to S2 vertebra is what you need to remember. Heart rate accelerates during inspiration, decelerates during expiration. What do you call it as? We call it as sinus arrhythmia. Whenever you are having inspiration, the heart rate will speed up, and whenever there is expiration, the heart rate will slow down. So this kind of speeding and slowing during the respiration is called sinus arrhythmia, is what you need to remember. Now, heparin, how does it basically function? Very good to see 14 online students. So don't forget, tell your friends also to come down 6 p.m. every day. Dr. Murali Bharadwaz is there with you to discuss 100 MCQs of the daily mock test. But you need to promise me morning after you wake up, you need to do the revision of these. I mean, you need to take it like a mock test. You have to challenge your mind. That is the only way this session looks more interesting and more useful for you. If you already solved this in the test, some questions you have gone wrong, some things you improved. Out of 100, if your score is touching 70 out of 100 corrects, then I can guarantee you, you are going to get the seat into the NEET PG. Heparin prevents coagulation. How does it happen? So heparin is a indirect thrombin inhibitor. So what it does, it activates antithrombin 3. And by doing so, it will antagonize the thrombin. Thrombin का दूसरा नाम क्या है? फैक्टर 2 मालूम है ना? 2 जब एक्टिवेट हो जाएगा 2A बन जाएगा. 2 को बोलते हैं प्रोथ्रोम्बिन. एक्टिवेशन के बाद बन जाएगा thrombin. And to inactivate this thrombin, there is something called antithrombin 3. And what is the function of heparin? Heparin activates this antithrombin 3. By that, it will inactivate the activated prothrombin into, that is the thrombin ko inactivate karega indirectly. So that is how heparin stimulates antithrombin 3, which inactivates the thrombin, is what you need to remember. Resorption of the bone, it is inhibited by estrogen. That is the reason the postmenopausal women whose ovaries are not producing the estrogen are subject to postmenopausal osteoporosis, is what you need to remember. What stimulates our thirst? Any increase in the plasma osmolarity or a decrease in the plasma volume? अभी तो समर आ गया, धूप बढ़ रहा है. So thirst is stimulated by any plasma volume contraction, which lead to increase in the plasma osmolarity, is what you need to basically remember. The ratio of the GFR to the renal plasma flow, what do you call that as? You call it as filtration fraction. GFR divided by renal plasma flow. So how do you know GFR? It is the inulin clearance which will give you GFR. PAH clearance will give you renal plasma flow. So please don't forget, this is one of the favorite important MCQ in the tomorrow's exam. Now, what is the inhibitor of the complex 4 of the electron transport chain? Cyanide. So once more, one of the dirty MCQ. I used to cry to remember this thing in the NEET, in the PG preparation days. Electron transport chain and the inhibitors. Of course, once upon a time, this out of 6 biochemistry questions going to come, electron transport chain used to be a very important question, but nowadays utna khas boost nahi hai. So complex 3 is inhibited by antimycin A and complex 4 is inhibited by cyanide, is what you have to remember. Which amino acid bindinase, alpha helix get disrupted, ducted. It is the proline. Proline सबसे छोटू है. जब छोटू घुस के जाके बैठ जाएगा, तब alpha helix will get broken. So it is the proline which is responsible for the alpha helix to take the turn. Every time the alpha helix is taking the turn, at the turning point, proline is the one which will be sitting, is what I want to underscore to all of you. Which RNA is involved in the production of the correct 3 end of the histone mRNA, doctor? It is snRNA, which is very, very important. So, अगर आप PGI, GIPR, DNB कुछ भी देखो, this is a favorite question. Small nuclear ribonucleic acid. It is also called the uRNA. The small RNA molecules are found within these splicing speckles in the eukaryotic cells, and they are transcribed by the RNA polymerase 2 or RNA polymerase 3, is what you have to fundamentally remember. So they are very important in the production of the correct 3 end on the histone mRNA, is what I want to underscore to all of you. Now, there are certain disorders which occur because of the problem in these snRNAs, small nuclear ribonucleoproteins. Spinal muscular atrophy, dyskeratosis congenita, Prader-Willi syndrome. Prader-Willi syndrome is which chromosome, doctor? Chromosome 15. मम्मी से मिलने वाले typically chromosome number 15. Chromosome number 15. So the deletion of the region of the paternal chromosome 15 that is not expressed on the maternal chromosome will lead to the Prader-Willi syndrome is what you need to remember. So fundamentally, that part of the chromosome 15 in Prader-Willi is there, no doctor. That is the brain-specific snRNA is what you need to remember. Now, xenoderma pigmentosum. What is the genetic defect? Nucleotide excision repair. Whenever ultraviolet rays are falling on our skin, they create the pyrimidine dimers. Pyrimidine dimers. Normally, these pyrimidine dimers need to be repaired. If this repair is affected, that leads to xenoderma pigmentosum is what I want to underscore to all of you. Allopurinol is an inhibitor of xanthine oxidase. Hypoxanthine to xanthine to uric acid. It is by the xanthine oxidase. If you stop that, you can stop the uric acid production is what you need to remember. Once more, आपके व्हाइट पेज नोटबुक में लिख लो, मुरली भरद्वाज गारंटीड टॉपिक क्या है डॉक्टर? गाउट, ड्रग्स इन गाउट. तुरंत आप इंकस ऐप में 2000 HD वीडियोस के पैकेज में आपको फार्माकोलॉजी में हमें गर्मा गर्म डिस्कशन किया. Almost 80 videos are there in pharmacology. Go to the gout drugs. क्योंकि ये sure short topic है. There will be no NEET PG exam without gout drug. My confidence, 500% confidence के साथ आपको बोल रहा हूँ. What is the first recombinant vaccine clone? Hepatitis B vaccine. स्विमिंग पूल में स्विमिंग करे तो कौन सा ग्रैन्युलोमा आएगा? स्विमिंग पूल ग्रैन्युलोमा. Keep punching your answers, doctor. Pramod, Gurjar, Ravi Kumar, and many more who are all online. Mycobacterium merinum is what you need to remember. So these are the typical lesions, doctor. This bubbles which you are able to see. Swimming pool granuloma is something that you need to remember. Which immunoglobulin has a specific role against the helminthic infections? Immunoglobulin G, which is the secretory immunoglobulin. Streptococci, Staphylococci. और एक बार आपके व्हाइट पेजेस नोटबुक में लिख लो, माइक्रोबायोलॉजी में 6 to 8 क्वेश्चंस आएगा. And in that 6 to 8 MCQs, sure short आने वाला क्वेश्चन बोलो. Streptococci, Staphylococci, you should not miss. बराबर? Streptococci, Staphylococci. Very good to see Moin, Lala, Mahi, and many more who are all online. बढ़िया बढ़िया बढ़िया. आप सब लोग इंकस ऐप का डाउनलोड किया सरकार. करने के बाद वहां 40 फुल स्केल ग्रैंड टेस्ट है. दिखाए क्या? दिखाए सरकार. रोज एक ग्रैंड टेस्ट ले लो, लाइक मल्टीविटामिन टैबलेट, और शाम को डॉक्टर मुरली भरद्वाज के साथ डिस्कशन में शामिल होना, चाय पे चर्चा. सो डॉक्टर, इट इज द स्ट्रेप्टोकोकस galactiae which is responsible for the. It is also called group B streptococcus, which is the beta hepatitis gram-positive streptococcus. And how do you identify the group B streptococcus, doctor? CAMP test. What is CAMP test का full form बताओ? Christie Atkinson Munch Peterson test. CAMP test. It is the one which is used to identify the group B streptococci. Is what I want to underscore to all of you. And what do you test in the CAMP test? It is the ability to hydrolyze the sodium hippurate is done in the CAM test. So if you look at the newborn GBS disease, group B streptococcal disease, you can divide that into early onset, late onset. Early onset hota hai 0 to 7 days, late onset hota hai 7 to 90 days is what you need to remember. Now, the special stain for Corynebacterium diphtheria, Albert stain, is what you need to remember. So this is how you identify Corynebacterium. The matchstick, drumstick appearance, which you need to remember. If you want to know whether pasteurization is perfectly done or not, how can you identify? Phosphatase test is used for knowing, testing the adequacy of pasteurization. Second generation antihistaminics, why they are better? They cause less sedation. Whenever the nose is running, you have taken a second generation antihistaminic. Still you can drive the car because it won't cause sedation. Less interaction with alcohol, less psychomotor disturbances. But always, sedation of an antihistaminic is directly proportional to its antipruritic action. Jada sedation diye to jada antipruritis, kujli kam ho jayega. So anything that decreases sedation will make it as ineffective antipruritic. That's the point you need to appreciate. Now, doctor, what are the drugs which are considered to be second generation antihistaminics? Astamizole, ketotifen, then ezelastin, they're all the second generation is what you need to remember. Which anti-malarial drug is used in combination with artemether? It is a lumefantrine which is combined. Which is an adrenergic neuron blocking drug, doctor? Guanethidine. So once more, you should know how tricyclic antidepressants function. How does bretylium guanethidine function? So all these, how does reserpine function? We have discussed all this in a great detail in our 2000 HD video program. So don't worry, you can just go back and do the revision, right? So guanethidine is an antihypertensive. It is transported across the sympathetic nerve membrane and it transports the norepinephrine, and the uptake is essential for the drug's action. Once the guanethidine enters into the nerve, it is concentrated in the vesicle and it replaces the norepinephrine. It inhibits the release of the granules by decreasing the norepinephrine. So that is how guanethidine basically functions, is what you need to remember. Erythromycin. Erythromycin, how does it lead to, how is it beneficial in patients with gastroparesis? Because erythromycin stimulates the motilin receptors. मैंने कल आपको क्या बताया? Short MCQ. How does tetracycline function? How does chlorantraniliprole act? Where aminoglycosides act? Where does rifampicin act? Which are 50S inhibitors, 30S inhibitors? Antibiotics, mechanism of action. Short topic. आप लिख लो आपके व्हाइट पेजेस नोटबुक में, अगर कल के नीट पीजी एग्जाम में एंटीबायोटिक्स मैकेनिज्म ऑफ एक्शन नहीं आए तो मेरा नाम मुरली भारद्वाज नहीं. Right? So, which drug is not used in H. pylori? Amoxicillin, metronidazole, omeprazole. Once more, H. pylori drugs is one of the hot topic. omeprazole, amoxicillin, clarithromycin for 10 days. Bismuth subsalicylate, metronidazole, lansoprazole, amoxicillin, clarithromycin, either 10 or 14 days. That is what we need to remember. Very good to see 17 online classmates. I want to see at least we should cross 50 every day evening. So, आप coaching कहीं भी ले लो, tension नहीं. But most important, lot of toppers acknowledge that last 60 days before exam, daily NEET PG mock test plus mock test plus daily live online discussion plus daily identifying 10 to 15 topics which are sure shot going to come in exam. This is the most well tested strategy by almost 2 lakh medical students took coaching with me. Good to see Dr. Anupama, Gautam Kumar, and many more who are all online. Now, these are all antiplatelets, aspirin, ticlopidine, clopidogrel, but not urokinase. It is thrombolytic, which is a proto-oncogene. Mike is a proto-oncogene. Once more, Dr. Pathology mein, out of 6 MCQs, apoptosis is guaranteed topic. Glomerulonephritis is another guaranteed sure shot topic. Click low. And one of the important favorite topic of the examiner is oncogenes. I leave the literature for you. Which oncogene, which cancer is it related? RAS protein, where do you find? Mike gene, where do you find? So, T-cell lymphomas. Good to see Tejasri Patil and many more who are all online. Very good, doctor. So, every day 6 p.m. Dr. Murali Bharadwaz, Sada aapke seva mein. Now, which vitamin influences the repair of the tissue? Vitamin C. HLA B27. Seronegative spondyloarthropathies like ankylosing spondylitis, Retus, psoriatic arthritis. 40-year-old male presents with a pallor with splenomegaly, peripheral smear shows few basophils. Shift to the left in the myeloid series. What is your diagnosis, doctor? Classical of chronic myeloid leukemia is what you should remember. And when do you call AML? Circulating leukemic blast, whenever you find circulating leukemic blast, then you call it as AML is what you need to remember. But these OR rods are there, no, doctor? They are the important indicator. OR rods, you are able to see the OR rods, right? So the OR rods are the indicator that bhaiya ye myeloid series का है, lymphoid series का नहीं, बोल के मालूम पड़ जाएगा. So doctor, once more, CD marker. Once more, this is a sure shot topic. You can't escape it. Even if you do prayer, you tell Lord Balaji, मैं 100 coconuts दे देता हूं तुझे, CD marker वाला क्वेश्चन नक को देना, फिर भी एग्जामिनर देगा एक CD marker वाला क्वेश्चन. Be very sure. So what is the marker for Langerhans cell histiocytosis? फटाफट आंसर्स टाइप करते जाना. डॉक्टर, CD1A is the marker for the Langerhans cell histiocytosis. The presence of the Beer-Beck granules and the immunopositivity of CD1 are very specific features to say it is Langerhans cell histiocytosis. Similarly, S100 protein is expressed in a cytoplasmic pattern. Then PNA, peanut agglutinin, is expressed on the cell surface. MHC class 2 is expressed because histiocytes are macrophages basically. And CD1A, langerin, which is CD207. It is the Langerhans cell restricted protein that induces the formation of the Birbeck granules. Is a highly specific marker, is what you need to remember. So that is the story of the Langerhans cell histiocytosis. Then S100 CD1A, kidney-shaped nucleus. This is another important buzzword that you need to remember. And you can see the classical lesions, calvarial lesions. You can see there are defects in the calvarium. In the Langerhans cell histiocytosis is what I want to underscore to all of you. Inactivation of BRCA1, CA2 is important for breast cancer. Once more, which chromosome number is BRCA1, which is BRCA2? That is another favorite question. A person with head injury remained unconscious for 3 days. He is being cured after 10 days and discharged. That is an example of a grievous injury. Emasculation, privation of any member or joint, permanent disfigurement of the head or face, fracture, dislocation of the bone and tooth, etc., etc., etc. Doctor, stellate, star-shaped wound, typically is produced by the contact shot. Pistol लगाया, gun चलाया, और मिल गया star-shaped. Stellate injury is one of the important injury of the contact shot is what I want to underscore to all of you. Hesitation cut. मैं कट करूं या नहीं करूं? कट करूं या नहीं करूं? कट करूं या नहीं करूं? Hesitation cut कहाँ होता है? Typically in suicide. Suicide में कट करूं या नहीं करूं? I love you बोलूं या नहीं बोलूं? So they are all hesitation cuts. Homicide में उतना hesitation नहीं रहता. काटना है तो सुपारी दे दो, काट दूंगा neck को. No hesitation cuts in homicide, only in suicide. Dying deposition versus dying declaration. All the differences you should know. So, if you look at dying deposition, recorded in the presence of magistrate, recorded with cross-examination, recorded in the presence of the lawyer of the accused, etc., etc. Oath is not necessary for recording dying declaration, whereas it is necessary for the dying deposition, is what you need to remember. In a dead body, mature maggots are found after how much time has lapsed since death? 24 to 48 hours is what you need to remember. Throughout the country, anti-malaria month is observed when? In the month of June, under National Vector-Borne Disease Control Program. Dementia, dermatitis, diarrhea, typically pellagra by niacin. 4 to 8 persons who are qualified to talk about the topic sit and discuss a given problem. What do you call it as? We call it as panel discussion, is what you need to remember. Primary prevention, immunizations, they're all primary prevention. Whereas early diagnosis and treatment comes under secondary prevention. Cervical cytology screening is early diagnosis treatment, secondary prevention. Smoking cessation after a heart attack is tertiary prevention. Self-examination of the breast for the lumps, even before lumps developed, you call it as primary prevention before emergence of the risk factors, is what you need to basically remember. At the end of 1 hour contact period, what is the minimum amount of residual chlorine? 0.5 milligram per liter. Material death is defined whenever there is a death happening after delivery up to end of Q period, that is up to 6 weeks. Framingham Heart Study is basically a kind of a cohort study in the integrated disease surveillance project. What type of diagnosis is done in PHC medical officer? Presumptive diagnosis. So presumptive is typical history and clinical examination is done. Probable. Confirmed clinical diagnosis by a medical officer and positive laboratory identification is called confirmed. The average number of girls that would be born to a woman, if she experiences the same current fertility pattern throughout her reproductive span, assuming no mortality, what do you call it as? You call it as gross reproduction rate, GRR. Whereas what is net reproduction rate, doctor? It is the number of daughters that would be born to a female if she passed through her lifetime conforming to the age-specific fertility and mortality rates of a given year. You call it as NRR. Total fertility. It is the average number of children that would be born to a woman over her lifetime if she has to experience the exact current age-specific fertility rates through her lifetime. So general fertility rate is the number of births in a year divided by the number of women aged 15 to 44 times 1000 will give you general fertility rate is what you should remember. For the prevention of the human rabies, immediate flushing and washing the wound with plenty of soap and water under the running tap for how long? For about 15 minutes. Yellow bag. What do you want to do? Incineration. Yellow bags identify medical waste treated by incineration. Completed family size के बारे में which measure will tell you? Total fertility rate will tell you. नेहरू जी के पिताजी, नेहरू जी का बेटी इंदिरा गांधी जी. Only thing missing in this is राजीव गांधी जी और उनका बेटा राहुल नहीं available है. So completed family size is total fertility rate. Then whenever fever is there, why do we get fever? Because the prostaglandin E2 levels increase in the hypothalamus is what you should remember. Bronchodilator reversibility test is used in the case of the bronchial asthma. Risk of sudden death, especially athletes, it is the hypertrophic obstructive cardiomyopathy, you should remember. Suddenly a football player suddenly dies, HOCM. Once more, doctor, valvular heart disease in general medicine, very high yield topic, especially HOCM. Once more, please go back to the Incus app. In the Incus app, you have 2000 HD videos which are available. Each 20-30 minute wala short videos which will cover almost all 953 high yield topics. Right? So, everyday test purpose is, why do you want to take test? Identify 10 to 15 sure-shot topics. So, आप 100 marks test किया समझो. Every day on the Incus app, you have done 100 MCQ tests. In that 100 MCQ test, for example, you got 60. That means 40 wrong. Identify what are the wrong questions. Then you attend the discussion with Dr. Murali Bharadwaz in the evening. And then identify 10 to 15 sure-shot topics. Then go back to the 2000 HD videos. In that, you finish revision of this 10-15 topics. Khatam. Last 40 days, every day do this. सीट नहीं मिले तो मेरा नाम मुरली भरद्वाज नहीं. Autosomal dominant disease. What is the risk of transmission? 50%. So you should know once more. Autosomal dominant, autosomal recessive, X-linked recessive, X-linked dominant, mitochondrial inheritance. इनका पेडिग्रीज को कैसे आइडेंटिफाई करना. शॉर्ट इमेज बेस्ड एमसीक्यू. सो अगर आप इंकस ऐप में गए तो 2000 एचडी वीडियोस में पैथोलॉजी में आपको इनहेरिटेंस पैटर्न बोल के एक वीडियो मिलेगा. उसका रिवीजन करो, उसमें पूरा चीज आपको साफ साफ बता दिया. What is a quick invasive test to identify H. pylori? Biopsy and doing urease test. So that is how you can be able to identify. Subdural empyema. Whenever any frontal sinusitis is there, middle ear infection or skull vault osteomyelitis, they all can lead to the development of the pus under the dura. Subdural empyema is what you need to remember. Coarctation of aorta and bicuspid aortic valve are together associated very commonly. Myeloplasma pneumoniae. What is the drug of choice? Typically, it is tetracyclines. Tetracyclines is what you need to remember. So, tetracyclines are the first line therapy in a lot of conditions. Rickettsia, Lyme disease, Q fever, psittacosis, lymphogranuloma venereum, mycoplasma pneumoniae. Don't forget, doctor, tetracycline is the favorite treatment of choice is what you need to remember. Very good to see Srijana, Sriram, and many more who are all online. Let me tell you, doctor, past 20 years, God gave me this golden opportunity to train almost 2 lakh medical students, almost every year 10,000 students in the past 20 years. A lot of them, thousands of them are top consultants, neurologists. आपके मेडिकल कॉलेज में जाओ, एक जमाने में only मुरली भरद्वाज. During 2000, 2005, 2010, in those days, only Dr. Murali Bharadwaz. जो स्टूडेंट फी पे करेगा लेते हैं, नहीं पे करे तो नहीं लेते हैं, फिर भी उनको ट्रेन करते हैं. Because we feel it is a God-given opportunity, a gift to inspire somebody every day. And the one who is thinking, maybe I won't get the seat this year, to hold their hand and make them to become the winner. Wow, what a pleasure that is. The God-given opportunity. So a lot of the students were sitting just like you, who are now the top consultants in Apollo Hospital, this hospital, that way, that hospital, top neurologists, top neurosurgeons. But one time they were all sitting with you with a similar kind of a uncertainty in their heart. भाई इतना कंपटीशन है, इतने लाखों लोग लिख रहे, हमको सीट मिलेगा या नहीं मिलेगा, नोटिफिकेशन आ गया, palpitation हो गया. First, believe in yourself, doctor. I want to once more tell you, believe in yourself. Part of the spine which is involved in rheumatoid arthritis. Generally, rheumatoid arthritis involves appendicular skeleton, not axial, but in axial, cervical involvement. So, rheumatoid arthritis involves metatarsophalangeal joints, but also it involves cervical spine. That's what you need to remember. So this is how the atlantoaxial involvement with the cervical spine involvement in the case of the rheumatoid arthritis. A normal anion gap metabolic acidosis, where do you see? Yesterday only I told you, NAG, normal anion gap metabolic acidosis, renal tubular acidosis, diarrhea, the sigmoidostomy, uterosigmoidostomy. So there are a set of reasons for non-anion gap metabolic acidosis. Whereas mud piles, salicylate poisoning, diabetic ketoacidosis, etc., they're all what? They're all high anion gap metabolic acidosis. Right? NARG and HAG. So you should know all the reasons. So diarrhea is an example of a normal anion gap metabolic acidosis. NARG or NAGMA. It is harder. So H is hyperalimentation, acetozolamide, renal tubular acidosis, diarrhea, uterosigmoidostomy, fistula, pancreatic fistula, NAGMA, harder is something that you should remember. If you want to know the iron stores, it is the ferritin, very sensitive. और एक बार आपके 200 पेजेस नोटबुक में लिख लो, sure short topic, iron deficiency anemia versus anemia of chronic disease. Take it as my word. Sure short MCQ, without that there is no question paper, doctor. अगर आप यूएसए में ली जाओ, नहीं तो प्लैब लिखो, नहीं तो एफएमजी ले लो, नहीं तो नीट पीजी में क्रैक करो, कुछ भी करो, डेफिनेटली आने वाला टॉपिक है आईडीए वर्सेस एसीडी. टेस्ट फॉर रिवर्सिबल कार्डियक इस्कीमिया, always thallium scan will help you. So thallium scan will enable you to discover what is the hibernating myocardium, which is ischemia, and reversible ischemic myocardium, which is irreversible ischemic myocardium. All these things you can know by the thallium scan is what you need to remember. Dissociate sensory loss. If you look at the spinal cord, doctor, you have the posteriorly transmitted, what are they called? Posterior columns. What do they carry? Vibration, position, joint, all that. Whereas you have the crisscrossing, decussating, anterolateral spinothalamic tract. So whenever there is a syringomyelia-like condition, the expanding central canal containing the CSF, it will expand and destroy these crisscrossing fibers, basically. So that is the reason the posterior fibers are not affected. So the patient will have loss of pain and temperature with the preservation of vibration and position, because dorsal columns are not affected, is what you need to basically remember. Sunil is asking, sir, kindly discuss long question. Bhaiya, long ho ya? There are long questions. There are long questions, Sunil ji. But it will be a mixture. All 200 will not be like USMLE pattern. Be very sure about it. There's a lot of hype. Need पीछे ऐसा होगा, वैसा होगा, ऐसा होगा, वैसा होगा, कुछ भी नहीं है, right? So in gynecology, obstetrics, sometime in surgery, we will give long questions. वहाँ मैं detail जाऊँगा. But there are also questions which are biscuit questions. You should know the logic, right? Now, diabetes, syringomyelia, Brown-Sequard, and lateral medullary syndrome of Wellenberg, they can lead to dissociated sensory loss. Similarly, multiple sclerosis, Davis dorsalis, Friedreich's ataxia, subacute combined degeneration also. Diabetes with a renal impairment. Still, pioglitazone can very much be used. Pioglitazone can be used safely in the people who are having impaired renal function. Wilson's disease is ATP7B mutation. Portal hypertension can be pre-hepatic and post-hepatic. So to Sunil, I want to tell you, we started on March 5th. Today is March 23. Almost 18 full-scale grant tests हमने डिस्कस करके छोड़ दिया. YouTube में अवेलेबल है ये ऑनलाइन MBBS चैनल में. आप जाके उस 18 previous test को देख लो. There are so many clinical vignette based questions. Okay, so you will get a practice. Best thing is download the Incus app and daily mock test ले लो. You'll get all the mixture. So lot of times coaching centers क्या करेगा? They try to make the paper as tough as possible in the name of a high quality multiple choice question test, but ultimately that will unnecessarily defeat your confidence and actual exam वैसा नहीं रहेगा. Be very sure, right? So doctor, Vardhathey syndrome. So you should know that you have the liver. There is an IVC. There is a heart. IVC is going and draining into the right side of the heart. Then you have the gut. From the gut, आएगा portal vein, which is formed from splenic vein, mesenteric vein. Portal vein drains into the liver, and it will form sinusoids, and all these sinusoids will merge. Dr. Anupama is saying, sir, FMGE paper discussion. क्यों नहीं? Definitely we will do FMGE paper discussion, INI CET paper discussion, analysis, everything, doctor. Don't worry. Yeah. Now, from the liver, the hepatic vein arises and it drains into IVC, and that goes into the right side of the heart. Is what you need to remember. So you have prehepatic causes whenever portal vein thrombosis is there, intrahepatic causes whenever liver cirrhosis is there, post-hepatic causes whenever hepatic vein thrombosis or IVC thrombosis or constrictive pericarditis. You should remember, whenever any problem in the IVC or in the hepatic vein or in the heart, you call it as post-hepatic causes is what you need to basically remember. Con syndrome. There is hypertension, metabolic acidosis, and expansion of the extracellular and plasma volume. But per se, aldosterone, what does it do in the kidney? So typically, you should remember in the distal convoluted tubule, it leads to the retention of the sodium. सोडियम को अंदर लेगा और पोटेशियम एंड H+ को यूरिन में भेज देगा. Because of that, caliuresis, you get hypokalemia. Because of the loss of H+, you get metabolic alkalosis. That is what you need to remember. In acute MI, what do you give? Antithrombin, fibrinolytics, platelet inhibitors, they are the important part of the treatment. Plasminogen activator inhibitor 1. It is a small molecule inhibitor which is used in the attenuation or the remodeling of the blood vessels. Now, what is the most specific and sensitive antibody, autoantibody used for SLE? Of all serological markers, anti-Smith is considered to be most specific, is what I want to underscore to all of you. And the anti-Smith antibodies are the units of the SNRNPs. Hepatitis E belong to calcivirus group. So the naked RNA viruses include calcivirus, picornavirus, reovirus. Hepatitis B belongs to Viridae. Then once more, I want to tell you, doctor, hepatitis E belong to calciviruses. What is the sure short MCQ in the tomorrow's NEET PG? All the DNA viruses, all the RNA viruses, and what are exceptions? Which is a double-stranded RNA, which is a single-stranded DNA. All these things, एक लिस्ट बना के रखो, definitely आएगा ये क्वेश्चन. 35-year-old chronic alcoholic, severe epigastric pain radiating to the back, C-reactive protein more than 350, rebound tenderness, acute pancreatitis, classically. So you should know all the prognostic factors of acute pancreatitis. Ranson's criteria. Once more, pancreatitis टॉपिक जो है पैथोलॉजी में है, सर्जरी में है, जनरल मेडिसिन में है, इसलिए शूट शॉट रहेगा कल के नीट पीजी में. The monoclonal antibody directed against CD20, which is used in rheumatoid arthritis, is called rituximab. Rituximab. CD20, anti-CD20. Once more, take it as my word. One MCQ जरूर आएगा monoclonal antibodies. It is a chimeric monoclonal antibody, rituximab. It is also used in lymphomas, leukemias, transplant rejection, etc., etc. इस टेबल को वंदनम करो, डेफिनेटली आने वाला. इस टेबल से अगर एक क्वेश्चन नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं, मैं टीचिंग करना बंद करूंगा. दिस इज अ श्योर शॉर्ट टॉपिक. डॉक्टर आपके 100 पेजेस नोटबुक में लिख लो. इन्फ्लिक्सिमैब, TNF alpha. So you should know, doc, as to infliximab, TNF alpha, adalimumab, TNF alpha. This is chimeric, this is human. That is also important. Basiliximab inhibits IL-2 on activated T cells. Dacalizumab inhibits IL-2 on the activated T cells, but this is humanized, whereas basiliximab is chimeric. Omalizumab, बड़े वक्त आस्थमा में यूज करते हैं डॉक्टर, आस्थमा में omalizumab. It is the one which inhibits the immunoglobulin E, is what I want to understand. So, doctor, I'm not going to read all these things for you. Your job is एक फुटवा ले लो. सारे बुक्स में अवेलेबल है ये लिस्ट, बट इधर मन के बुक में रिकॉर्ड होना. A 20-year-old male presenting with bilateral acute onset of ankle knee arthritis with abdominal pain, palpable purpura. Khatam. Henoch-Schönlein's purpura. Henoch-Schönlein's purpura. Typically in the buttock area, you find the palpable purpura. Hypertensive intracerebral hemorrhage, very commonly seen in the putamen, most common location. A 15-year-old boy with daydreaming. Oh my God. Please check whether he is the NEET PG aspirant. Decline in school performance. Oh my God. What is the possibility? The child will look through the teacher, not look at the teacher. Look through the teacher. टीचर के अंदर से पेनिट्रेटिंग लुक्स दे दिया, ऐसे ही देखते हुए उस अजनबी लुक क्यों होता है? एब्सेंस सीजर is what you need to remember. Arpit Prajapati is saying, sir, वो monoclonal antibody का list नहीं दिख रहा. अरे सरकार, कोई भी book देख लो, मिल जाएगा. Most important thing is that is the list of table. Either by now, that is the favorite important point of it. Now, CSF to serum glucose ratio less than 0.4. That means hypoglycemia. Where do you see? In bacterial meningitis. Once more, what is the favorite topic? लिख लो आपके sure shot topic वाला list में लिख लो. One question आएगा meningitis. Straight from this table. Bacterial meningitis versus fungal meningitis versus tubercular meningitis versus viral meningitis. Will you promise me that you will remember this, reproduce this in the tomorrow's exam? Acute onset of the blindness with a preserved pupillary light reaction. Where do you see? Anton syndrome. Acute onset of blindness but pupillary light reaction is preserved. It is also called Anton-Babinski syndrome. ये बेबिंस्की साहब उन दिनों में बहुत रिसर्च किया. It is also called visual anosognosia because of a damage in the occipital lobe. That brings the cortical blindness. So once more, doctor, what is the favorite question of the examiner? Lobar functions. What does parietal lobe does? What does frontal lobe does? Who decides your personality? Frontal lobe. Who is important for the vision? Occipital lobe. Who is important for the spatial perception? Parietal lobe. So all these things, lobar dysfunction. Today only download the Incus app. उसमें 2000 HD वीडियोस का पैकेज है. 20 to 30 मिनट में वीडियोस है. मेरे प्यारे भारतवासियों, अब क्या करना है? इस 2000 HD वीडियोस को आप दिल लगा के those topics which I say sure shot in the mock test discussion, just go back and do the revision note. Dejerine-Roussy syndrome or thalamic pain syndrome is caused by the stroke in the thalamus. So one of the options given to you was Dejerine-Roussy. The thalamus में अगर infarct हो गया तो पूरा half the body patient will feel, oh my God, so much pain, doctor. Only one side, one half. And the pain will be so severe. Oh my God, my flesh is torn from my body. That's what the patient will say. That is the Dejerine-Roussy syndrome is what you need to remember. Similarly, Bellin syndrome. So whenever Bellin syndrome is there, in a symmetrical structure, only one half is felt, the other half is not felt. That is called simultagnosia. Is a very important. If you ask them to draw, no, they will only draw half. So, inability to perceive the visual field as a whole, one half, simultagnosia. Difficulty to fix the eyes, oculomotor apraxia. Inability to move the hand to a specific object by using the vision, optic ataxia. So why do you get Bellin syndrome? Any bilateral border zone infarction in the occipito-parietal region, you get the Bellin syndrome. And also, when you move the object, the previous image position will remain persistent. That's called visual perseveration. Also called pelinopsia. Pelin means again. Opsia means seeing. So persistence of the visual image after the stimulus is being removed is called pelinopsia. So that is also another important part of these occipito parietal borderline zone lesions. Waldenstrom's macroglobulinemia. What do you see? A positive Kuhn test, hyperviscosity, M component in serum, but hypercalcemia is only seen in 4% of patients. Hyponatremia may be there. So, doctor, all these clinical definitions, favorite question. Monoclonal gammopathy of unclear significance. What is the criteria? Waldenstrom's macroglobulinemia. What are the criteria? Multiple myeloma. What is the criteria? All these things, doctor. Once more, let me tell you. This PowerPoint, whenever you go to the Incus app, in the Incus app, in the footer, you have 4 things. You have 4 things in the footer. One is courses. Next, short videos which are free. Short videos which are all free. Which are like TikTok, like 3-minute videos. YouTube can upload. Then you have a record button. YouTube can create revision videos, 3-minute videos. Your videos will be liked, shared, followed by a lot of students worldwide. Then you have your dashboard. So यहाँ courses में गए तो आपको NEET PG में category में you have a quiz course, flashcard course, video course. A quiz course में आपको one of the packages is daily NEET PG full scale grant test, 40 grant tests. And there you find the full scale grant test available. So you please do the revision of that. I mean, you solve that. Then it will move into history. In the history, you can do the revision. And also this PowerPoint is attached to that history. That is the beauty part of the Incus app. Also this video of discussion also is attached to that particular mock test. So video discussion कर सकते हैं, PowerPoint को revision कर सकते, नहीं तो टेस्ट ले सकते, सब कुछ कर सकते. Chronic myeloid leukemia. It is the stem cell transplantation is considered to be the curative treatment, the only curative treatment. If you want to diagnose paroxysmal nocturnal hemoglobinuria, once more, in the hematology, this is one of the favorite topics, doctor. We use flow cytometry. Flow cytometry. So this is how, by using flow cytometry, you look for the CD55, CD16, CD66. So CD55, CD59 flow cytometry is the gold standard for diagnosing PNH. Once more, आप Incus के ऐप में गए तो 2000 HD videos जनरल मेडिसिन में paroxysmal nocturnal hemoglobinuria 20-minute video is there. Please do the revision. Nephrotic range of proteinuria means 40 milligram per meter square. Premature fusion of the coronal, sphenofrontal, frontoethmoidal sutures. What do you call? Turricephaly. So turri means tower-like. This looks like a tower. जो tower होता है, turricephaly is what you need to remember. Oxycephaly, also called turricephaly, acrocephaly, steeple head, tower head, etc. It is the premature fusion of the sutures and Now, this is called dolichocephaly. Dolichocephaly. 1 minute. So, dolichocephaly. So, this is normal है तो ये बन गया dolichocephaly. So, this is how a dolichocephaly looks like. Head is longer than expected. The head is longer than expected. And plagiocephaly, whenever the coronal suture is fused, then what you get is called plagiocephaly. Then sometimes positionally, there can be a flattening and distortion of the skull shape. So this is how this side बराबर है, वहाँ यहाँ तो जरा flatten हो गया, positional. Now, in a HIV-infected mother who received only zidovudine, whenever she is breastfeeding, what do you want to give? Nevirapine. So there are certain guidelines, antiretroviral therapy guidelines for the pregnant women. You have to be 100% sure. So infant should be treated with 4 to 6 weeks of once daily nevirapine or twice daily zidovudine is what you need to remember. For the first sign of puberty, doctor, testicular enlargement. So once more, all these different stages of the puberty progression is a favorite question. Children with thalassemia and iron overload, there's the risk of developing Yersinia enterocolitica. Zinc deficiency lead to skeletal abnormalities, immune dysfunction, sexual immaturity. Low osmolarity WHO ORS. उसका osmolarity क्या होता है? 245 milliosmoles. So glucose is 13.5 grams, sodium chloride 2.6, potassium chloride 1.5, trisodium citrate 2.9 in the rhizomol. In rhizomol is what you need to remember. So total osmolarity होता है 245. So how do you remember these numbers? So remember 75. So both sodium and glucose, it is 75. Subtract 10 and you have the osmolarity for chloride, 65. And remember 20 for potassium and subtract 10. You get that of the citrate. Then how will you remember this? Sodium chloride is 2.6 and potassium chloride is 1.5. If you remember, for sodium chloride is 2.6, flip the 6 upside down, it becomes 9. So citrate बन गया 2.9. बराबर? ये 6 को flip करे तो 9 बन गया ना 2.9. -1 will give you from 2.6, it becomes 1.5 for the potassium chloride. So don't tell Dr. Murali Bharadwaz teach like this, but there is no other way, some stupid way to remember. Central precocious puberty in a girl. If the breast development starts before 8 years. So normal Apgar score, even with acidosis, where do you see? Acidosis, generally Apgar score will be low if there is acidosis. But normal Apgar score with acidosis क्या होता है? False negative. So you should know what lead to false negative and what lead to false positive. That means Apgar is abnormal So the kid is normal, no acidosis. So you should know all these reasons, doctor. So false positive, there is no fetal acidosis or hypoxia but a low Apgar score. Prematurity, max sulfate, precipitous delivery, congenital myopathies, neuropathies, lung anomalies, etc. False negative, there is acidosis but normal Apgar score. Whenever catecholamines are high, they will make, even if acidosis is there, still Apgar score looks to be normal, especially when catecholamines are high. So whenever there is any metal acidosis, high fetal catecholamines, small, some of the full-term infants, etc., etc. When will child start telling stories to you? 4 years. Anal fistulas, intersphinctering, transsphinctering, suprasphinctering. Whose classification is it, doctor? So this is intersphinctering, perianal, supra-elevator, levator. So they are all Park's classification. Wick hand striae, all this fishnet-like appearance inside the buccal mucosa is a feature of lichen planus. In leprosy, where do you take nanobiopsy? Sural nerve is what you should remember. What are the stages of hair growth? Anagen, telogen, catagen, seborrheic dermatitis. It is the pitriosporum, which is pitriosporum involved in seborrheic dermatitis. So these are the classical lesions of seborrheic dermatitis is what you need to remember. Yeah. So it is the Malassezia furfur. Malassezia furfur, also called Pitriosporum ovale, is what you need to remember. What is the complication of effectively ventilating a patient with positive pressure ventilation if there is a bronchopleural fistula? Then you are pushing a lot of air into the lung and leading to tension pneumothorax. How many hours at least patients are kept nil by mouth pre-operatively to prevent aspiration? 4 to 6 hours. Through the tracheal tube, what are the drugs administered? Dr. Vasopressin, adrenaline, or atropine? A mild type of local anesthetic, which is used to know the presence of atypical cholinesterase. What is that called? Dibucaine. There is a dibucaine number. First stage of labor, अगर आप analgesia देना है तो T10 to L1 should be blocked. So T10, T11, T12 and L1, first stage of labor. Pain is dull and poorly localized. And all the uterine contractions release the bradykinin, histamine, serotonin. And there is a stretching of the lower uterine segment and cervix. And that is transmitted by T10, T11, T12 and L1. Second stage, it is the perineum that stretches. And that typically will act on S2, S3, S4 through the pudendal nerve. And whenever you are giving epidural analgesia, starting at T10 to L1, you are creating the sensory block, is what you need to remember. So, doctor, Shanti, Shanti, Shanti. Thank you all for joining this wonderful evening and making a great time. Now, do you know what are those 10 to 15 topics you should master immediately. And once more tomorrow, when the sun rises, go to the Incus app, take the mock test, identify where are you going wrong, participate in the discussion tomorrow evening, and finish 10-15 topics every day. Still, कितने दिन है हमारे लिए? 22 days are there. 22 into 10 topics also is 220 topics are perfect हो जाएगा. And you will become toppers. And send me laddu on the WhatsApp. Right? So good night and see you all tomorrow evening at 6 o'clock. Thank you.